and sometimes they can be confused with other lumps or lesions that look just like warts. And so doctors will have to take a little bit of tissue known as a biopsy to examine them closely and work out which is which. We don't diagnose genital warts using blood tests or scans. So now let's come to the purpose of this video, which is the treatments for genital warts. Before we start, it is always best to see a medical professional if you think or suspect you have genital warts. And this is because whatever treatment option you decide to go with, it's essential to test for other sexually transmitted diseases, which you may have at the same time, but they show up later and will require a different sort of treatment altogether. So first, option 1 is no treatment. This is doing nothing, leaving the warts alone. This option is often discarded as unimportant, but 30% of warts that you see actually disappear by themselves within 6 months of developing. The problem, of course, with this method is that 6 months is a long time to wait, and having those warts while you're waiting can affect your body image and affect your sexual relationships as well. So next are the more common or favored options. These are skin preparations that are applied as creams, ointments, or lotions to the skin. There are a few of them. Some can be self-applied, although if you have warts covering a large area, you may need help from your doctor or nurse to apply them for you. In this category, we have podophylotoxin, imiquimod, or cinecatechins. Let's begin with podophylotoxin. You will find this available under several brand names. Using this cream needs medical supervision if you're treating genital warts in women and men if they have very large warts. And this is because your doctor or nurse can help you with the precise location of the warts and where exactly to apply the treatment when you get home. It comes as either a cream or liquid preparation. The treatment with this is usually for 3 days every week for a number of weeks. The number of weeks or courses that you will have to take the treatment will depend on the nature and the extent of your warts, and your doctor will be in the best position to advise about this. So let's look at some of the side effects that can happen. The cream can lead to skin irritation, which may develop on the second or third day after you start treatment. This irritation is mostly mild and it will go away when you stop using the cream. However, sometimes the irritation can become quite severe and some people may develop sores or ulcers on their skin. Please be careful not to apply this cream on open wounds or even normal skin, and avoid getting the cream on your eyes or around your eyes when you're using this treatment. Also, watch the amounts you're using. Thin applications are best because applying the cream on excessively doesn't get the condition better any faster and increases your risk of serious complications like kidney damage, bowel problems, and much more. Finally, pregnant and breastfeeding women should not use this medicine.
Hi, I'm Dr. Sylvia, a GP and health educator. I hope you're finding our videos helpful. I wonder, have you been feeling off but no idea why? Tiredness, aches, unexplained mysterious symptoms? Let's connect the dots. I take a holistic approach at yourgpconsultation.com to figure out what the problem is. We can arrange tests, refer you to a specialist to get to the bottom of things. So book a consultation with me. I'll help you feel like you again. Check out the link in the description box or my bio.
So next, let's look at imiquimod, which also has different brand names depending on your location. The duration of treatment with imiquimod is lengthy, up to 4 months, and this is while using the cream 3 times a week and usually best at night time. You apply the cream directly onto the warts, not on normal skin, rubbing thinly into the wart tissue and leaving the cream on for at least 6 to 10 hours, which is why it's best at night time. Afterwards, you need to wash the cream off with mild soap and water. It's also important to have medical supervision when you're using this cream so that you know exactly where you are putting it on at home, and it is not meant at all for internal use. The best way is to continue using the cream until all the warts you can see have disappeared, but it should not be used for beyond 4 months altogether. Common side effects include redness or irritation and pain around the warts, because imiquimod very quickly stimulates your immune system just after a few applications. If that happens, stop using the cream until the redness settles, and then you can gradually restart the cream, this time using it once or twice a week instead. Other side effects are joint and muscle aches and headaches. Less commonly, they can lead to irritation of other tissues, diarrhea, and mood changes. Imiquimod may also lead to permanent color changes to your skin, in some cases bleaching or darkening the skin in the area where it's been used. Please read the accompanying medication leaflet to learn how to use it and its potential side effects. When you have genital warts, ideally you should abstain from sexual intercourse until your treatment is over and the warts have completely cleared. If this is not possible, please use condoms. However, be careful with imiquimod cream and latex condoms or vaginal diaphragms, because imiquimod can weaken or damage them and make them ineffective. The other thing to remember is avoid having sex while you have the cream on, because it could irritate your partner's skin. And the third wart cream we're looking at today, that can be self-applied for external genital warts, contains the green tea extract epigallocatechin gallate, also known as cinecatechin. Watch out for different brand names where this product might be sold. So the cinecatechins are applied thinly by hand over the particular wart lesions, and there is no need to wash it off after application. Treatment should continue until the warts have all cleared and should not continue after 4 months. The cinecatechins can also cause skin irritation. Be careful not to use it over normal skin and to have sex while you have the cream on. This one could also weaken latex condoms or vaginal diaphragms, so you will need to wash the cream off if you intend to have sex using condoms or diaphragms. When you're using any of these active skin treatments for treating genital warts, please remember the following. First, they can take between 1 to 6 months to work, so you have to be patient. Some people may see some improvement within 4 to 5 weeks using the podophyllitoxin or cinecatechins. But for imiquimod, it may be 2 to 3 months before you start seeing any benefits. If there is no response after using the creams for these periods, you should stop these treatments and seek some alternatives. Number 2, they may not be very effective, especially the first time around, and you might need more than one course of treatment to eliminate an outbreak of genital warts. Number 3, even after completing these treatments, genital warts can come back. In other words, you might experience a relapse, and this is because these creams do not eliminate the human papillomavirus. And number 4, please remember that these skin treatments in some cases can cause some discomfort or skin irritation. I know I've said this before, but using condoms is important if you can't abstain while you're on treatment. Be careful with the creams that could affect the effectiveness of your condoms. Additionally, if you smoke, stopping can improve your response to the treatment.